Hey everyone, welcome and welcome back to my channel. In today's video, we're going to talk about calcium channel blockers. We'll discuss dihydropyridines and non-dihydropyridines calcium channel blocker. Please don't forget to like the video, subscribe to the channel, and turn on your notification bell so you don't miss out on any new uploaded videos. Okay, let's get started. Let's talk about the mechanism of action of dihydropyridines and non-dihydropyridines. Dihydropyridines inhibit influx of calcium ions into vascular smooth muscle and myocardium. Influx of calcium ion causes vasoconstriction. So by inhibiting the influx of calcium ion, then that leads to peripheral arterial vasodilation, decreased peripheral vascular resistance, and decreased blood pressure. Non-dihydropyridines also inhibit influx of calcium ion into vascular smooth muscle and myocardium. It is important to note that non-dihydropyridines are negative inotropes and negative chronotropes. So by negative inotrope, that means that they weaken the force of contraction of the heart. And by being a negative chronotrope, that means that they decrease the heart rate. So an effect that non-dihydropyridines have that dihydropyridines do not have is that they can lower the heart rate because they're a negative chronotrope. So that's very important. What are some of the common medications in that class? So medications that belong to the dihydropyridines calcium channel blocker, they typically end in PINE. So for example, you have amlodipine, nifedipine, felodipine. So amlodipine, the brand name is Norvasc. Nifedipine, brand name Procoria or Adalat. Felodipine, brand name is Plendil. For non-dihydropyridines, example of medications in that class are diltiazem or cardizem, verapamil, or Calin. What are calcium channel blockers used for? Dihydropyridine calcium channel blockers, so like amlodipine, are commonly used to treat hypertension. They can also be used in angina. Non-dihydropyridines like diltiazem or verapamil can be used for atrial fibrillation and atrial flutter. They can also be used for hypertension, definitely not first class for hypertension, but they can also be used for that, and then can also be used for angina. Let's look at this practice question together. Which of the following drugs is a calcium channel blocker? Determine its brand name. A. Clothalidone, B. Enalapril, C. Amlodipine, D. Furosemide. I'll give you 5 seconds to write your answer in the comments below. What do you think the answer is? Is it A, B, C, or D? And then also write whichever answer you choose, write the brand name in the comments as well. So if you chose C, amlodipine, then you would be correct. So remember, I mentioned, so amlodipine is a dihydropyridine calcium channel blocker. So I mentioned that the dihydropyridines calcium channel blockers, they typically end in PINE. So that's amlodipine. The brand name for amlodipine is Norvasc. Now, the other answers are incorrect because clothalidone is a thiazide diuretic, enalapril is an ACE inhibitor, and furosemide is a loop diuretic. If you want to know more about thiazide diuretics, ACE inhibitors, and loop diuretics, check my videos on those classes of medications. I'll have them linked in the I have them linked down below. What are some of the common side effects of calcium channel blockers that we need to be aware of? And what do we need to monitor when taking calcium channel blockers? So for dihydropyridines calcium channel blockers, so those are your amlodipine, nifedipine. Side effects include peripheral edema, headache, palpitations, flushing, and monitor blood pressure, heart rate, and monitor for peripheral edema. For non-dihydropyridines, such as diltiazem, verapamil, some side effects include edema, headache, dizziness, bradycardia. Remember, I mentioned earlier that they can lower the heart rate, hypotension, and monitor blood pressure, heart rate, and ECG. Which of the following medications can lower the heart rate? A. Amlodipine. B. Diltiazem. C. Verapamil. D. A and B. E, B, and C. Write your answer in the comments below. 2 seconds. That one should be easy, right? We just talked about that topic. Okay, so let's dissect this. So all of your answers, A, B, and C, they're all calcium channel blockers, but amlodipine is a dihydropyridine. Diltiazem and verapamil are non-dihydropyridines. So the non-dihydropyridines are the ones that can lower the heart rate. So that means your correct answer would be E, B, and C. So both diltiazem and verapamil. Some contraindications and or precautions when it comes to calcium channel blockers. So for dihydropyridines, caution if aortic stenosis. For non-dihydropyridines, second or third degree AV block, if systolic blood pressure is less than 90, or if cardiogenic shock. Which of the following is true about the use of amlodipine? A. It is a calcium channel blocker that can be used for the management of hypertension. B. It can cause palpitations. C. It is a negative chronotrope and therefore can lower your heart rate. D. A and B. E. A and C. Write your answer in the comments below. Which one do you think it is? Okay, so let's look at each option. So option A, it is a calcium channel blocker that can be used for the management of hypertension. So that is true. It can cause palpitation. That is also true. It is a negative chronotrope and therefore can lower your heart rate. That one is false. Amlodipine is a dihydropyridine, so the non-dihydropyridines are the ones that are the negative chronotrope. So C is false. So that means the right answer would be D, A, and B. That's all I have for you for today. Please don't forget to like, subscribe, and turn on your notification bell on your way out. I'll see you in the next one. Bye.